This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
So we have talked a lot this month about stroke. It's Stroke Awareness Month, so of course we are. We've learned about stroke symptoms. We've learned about risk factors. We've talked about treatment, the importance of calling 911 if you think you're having a stroke. Well, one topic that we haven't really touched on that much is how stroke can affect your speech, even your swallowing. So as we continue our stroke awareness efforts, I'd like to welcome PRMC speech language pathologist Sarah Carey. Sarah, thanks for joining us this afternoon.
Thank you for having me.
So let me start off very basic, very simple. Explain to me what it is that happens during a stroke that can affect your speech and even affect your swallowing.
Well, depending on where a stroke occurs within your brain,
Okay.
If it is in the language section of your brain, it can affect your ability to communicate, expressive communication, receptive communication. You can have cognitive linguistic deficits and also swallowing deficits.
It can do that too. What is the most common impact you've seen?
Being at PRMC at the hospital, what we see most often and what we work with most often is going to be swallowing disorders. In addition to that, it would be speech and language disorders.
Wow, so it all wraps up in there. So explain to me more about the swallowing deficit. What's happening here? What does that mean?
So when someone experiences a stroke in their brain, again, depending on where the deficit has occurred, it can affect your functional swallow.
Okay.
And that is what we call dysphagia. And there are different stages of the swallow. There's an oral phase, what happens within your mouth, and there's a pharyngeal phase, what happens within your throat. Again, depending on where the stroke occurred, it could affect one or the other or both. So for a speech language pathologist, what our job is to do is to go in and evaluate a patient, figure out where the deficit lies, and figure out what diet consistency is going to be safest for that patient. When someone is experiencing a dysphagia or a swallowing deficit, they're at very high risk for aspiration. And that is when food or liquid can get into the wrong pipe and land in your lungs as opposed to into your belly.
Okay. Wow. That's a lot going on. So that makes it complex even just to eat and drink.
Yes.
That's simple.
Yes.
Okay. What is cognitive linguistic deficit?
This is something that, again, depending on where the stroke occurs in your brain, some patients can present with a cognitive linguistic deficit. These individuals might have difficulty with attention or with memory, executive functioning, being able to be aware of where their deficits are and how dangerous they might be for that person.
Can it affect your reading and your writing ability too?
Yes, it absolutely can. Alexia is something that can affect your ability to read, and then it also can affect your ability to write the words.
So if you've had a stroke and you've had these problems, these effects, can you recover from this? Is this something that can come back?
Yes, and that's where we advocate a speech language pathologist to come into the picture. In an acute care setting, in a hospital setting, like I said before, what we mostly focus on is going to be the swallow function.
Right.
But we also will focus on the language abilities, expressive language, receptive language, speech, which is the way that you're talking sounds. Oftentimes with patients who have experienced a stroke, their speech will be very slurred or slower than normal. So we'll work on all of these things. Then from the acute setting, we will send the patient most oftentimes to an outpatient setting to have some outpatient rehab for a week or 2 weeks, 3 weeks, however long it's deemed appropriate for that person with the attempts to recover. There's no way to say, yes, you will get back to 100% and be perfectly normal again.
Right.
But that's always our goal, is to get patients on the least restrictive diet, so back to regular food, regular liquid. Within the speech world, there's a whole tier of food and liquid. Pureed food, kind of like baby food, is the bottom of the totem pole.
Okay.
Then we move to some softer foods, things that are nice and easy to chew, and then we have regular food. So depending on where that person lies with that dysphagia that they're experiencing, we figure out what consistencies are safest. Same with liquids. There is regular liquid that we drink all day, every day.
Right.
If someone's experiencing a dysphagia, what we do is thicken some liquids to different consistencies to figure out what's safest for that person.
So each case is different. No, it's not.
Very different. Everyone has a individualized plan.
My goodness. Sarah Carey, thank you so much for explaining all that. Some fascinating information that we really, really need to know. Okay.